people need a doctor, others need a nurse. Some people need psychiatrists and others need a hearse. Some want physical therapy and that's just fine by me, but to change your life, find out about occupational therapy. Will you help me find a job? It's not quite what we do. Are you a physical therapist, close but still wrong too? Will you help me be independent with the things I want to do? Name the task, whatever it is, OT will help you.
Hello, my name is Chris Bellucci with Court J-Town Physical Therapy and Hand Center. I'm an occupational therapist that specializes in hand therapy, and I want to tell you a little bit about our clinic and stuff that you'll use for a typical evaluation in the clinic. Some of the tools that we'll use when we're looking at a patient, we're going to look for range of motion, strength, sensation, and also try to understand their subjective assessment of how they're functioning. For that, we'll use this paper, the Quick Dash. That's basically 11 questions that ask the patient how they feel like they're functioning so we can understand how they feel like they're doing. Something else that we look at is range of motion. We use goniometers for the fingers. We use them for the wrist, and we can also use them for the elbows or the shoulders if needed. We sometimes measure girth with tape measures. We can measure sensation with 2-point discrimination, with also monofilaments or Simmons-Weinstein testing. We also can test for temperature as well, hot and cold sensation. For strength, we can use manual muscle testing, or we can use the pinch gauge or the dynamometer. These are just some of the common objective assessment tools that we use in an occupational therapy evaluation, on top of subjective, which could include the patient's subjective reports of pain, how their functional use is, how their sensation feels, and how their ADLs in daily life is affected. Yeah. One of the commonly used modalities in this clinic is this fluidotherapy machine. Inside is a synthetic corn husk. The particles will circulate, which will desensitize a patient's hand, and it also warms up to about 110 degrees, which will help increase blood flow. The combination of the desensitization and the heat will help a patient gain range of motion in a pain-free area. It's a very popular machine in the clinic, and it's commonly used as a pre-exercise to therapy. Another commonly used modality, preparatory, is the paraffin bath. Patients can put their upper extremity and hands inside of this wax bath, which is about 125 degrees. That will heat soft tissue. I commonly use it for scar tissue as well as stiff joints and hands. Patients will sit in the paraffin wax for around 10 to 12 minutes. The wax comes off the hand, is able to move a little bit better. It can also help decrease pain with motion. So another good modality used in the clinic is electrical stimulation. There are different wave currents and frequencies that we use with patients depending on what we want our outcome to be. One is TENS, or transcutaneous electrical nerve stimulation. There is interferential current, Russian current. This machine also does ultrasound, and these are modalities that we use to either decrease edema, increase blood flow, and decrease pain on patients. This is a larger machine that has multiple settings as well as an ultrasound, while we also have handheld settings that can be easily worn by the patient if they want to take them home for a home program, or just use them so they can walk around the clinic while they're performing exercises. Another common facet to an outpatient hand center like this is our work conditioning and workers' compensation patient caseloads. A lot of patients get injured on the job or can't go back to their job because of injury. So here we can simulate job tasks that people have to do so that they can get back to their prior level of function in order to achieve their goals for work. So here we can do a lot of lifting, pushing, pulling, assembling, or whatever the job tasks are that the patient requires to get back to work. Okay. Another very common aspect of hand therapy clinic is splinting fabrication. So we do a lot of custom-made splints, whether post-operative or pre-operative, to ensure a patient is held in the right position and to enable both either range of motion and function. So with the splint heating pan and splint material, we can mold custom splints for individuals depending on what their needs are.
Surgery. I started after that.